Welcome back to TV5 News at 9. Other than skin cancer, breast cancer is the most common form of cancer among women and the second most deadliest. Calling in this morning to tell us more, we have Dr. Brooke Spencer from McLaren Proton Therapy Center. Thanks for being here.
Thank you for having me.
Yes, Dr. Spencer, tell us what makes breast cancer so deadly.
Breast cancer is the most common cancer that affects women in the United States. 1 in 8 women will be diagnosed with breast cancer. And some barriers to, effective treatment and survival include access to care and lack of screening. So those two components are very important in terms of improving outcomes for breast cancer patients.
And how can we as women protect ourselves from breast cancer, or at least improve our chance of survival?
So the recommendations that have been put out by the American Cancer Society, as well as other organizations, include mammographic screening between the age of 40 and 50 for average risk women, and sometimes even earlier for women who have first degree family history of breast cancer or genetic predisposition to breast cancer. So once again, having mammograms and also doing self-breast exams are really important in terms of catching the cancer early. The chance of cure and improved survival increases with treatment and catching the cancer early. So screening is very important.
My mother is actually a mammographer, so I know firsthand early detection is always key. Tell us, when is radiation treatment an option, and why might proton therapy make a better option?
Radiation treatment is an option for patients with early stage and locally advanced breast cancers, in addition to some patients that have metastatic breast cancer when we're treating for the intent of palliation or for symptom management. So generally what happens is a patient usually will have surgery to confirm their diagnosis, in addition to another type of either a lumpectomy or a mastectomy. And at the time of surgery, we're able to decide whether radiation makes sense based off of pathological findings at the time of surgery.
And McLaren Proton Therapy Center, that's one of only 2 in the state that offer this kind of treatment option. How would a newly diagnosed woman find out whether this is an option for them?
Proton radiation is an option for patients that have had prior radiation treatment to the same site. For some women who have genetic mutations that increases the risk of sensitivity to radiation. It's also indicated for patients with left-sided breast cancer to minimize radiation dose to the heart. And to find out more information, you can go to mclaren.org/proton therapy. Another way to inquire would be to call 855-MY-PROTON. That's 855-MY-PROTON.
All right, lots of good reminders there. Dr. Spencer, thank you. Is there anything else you want people to know when it comes to breast cancer?
Many women live a normal lifespan who are diagnosed with early stage breast cancer, and that comprises about 2/3 of women. And so it's really important to have mammograms and to follow through with treatment recommendations once you're diagnosed. The future is bright in terms of new technologies such as proton therapy. And we're really excited to offer that to our patients when there is an indication.
We are thankful to learn more information about proton therapy. Dr. Spencer, thank you so much. As always, you can find more information on today's topic by just going to our website. Just visit the hot link section on WNEM.com.